Hi everybody, my name is Giuliana and today I'd like to share with you my opinion about circumcision. About 20 years ago I delivered a healthy baby boy, and my husband and I were faced with the decision making on something very important, not only for us as parents but also for the future sexual life of our baby son. Um, in 1999, the trend of using circumcision as a must after delivery of baby boys seemed to have decreased. The Association of American Pediatrics seemed to indicate a stand that stays neutral to the fact of whether or not circumcise a child, keeping in consideration obviously that there's some factors such as decreasing, infection and STDs transmissions and HPV, cancer, penile cancer, and all of that. There's also some factors of culture and of look and the way that parents do or do not feel comfortable with the practice itself. There was an article that I used and I read about, and I used it back then when I made my decision, but I used it again this time, of the AAP, that indicates the fact that there's really very marginal inclination of the medical society to embrace circumcision. The other factor is a study of the Sackler Faculty of Medicine in Tel Aviv that has used a pool of children, all circumcised obviously for cultural reasons, and seem to be able to prove the fact that children that are circumcised within the first 8 weeks of age are exposed to more frequent UTIs than children that are not. And part of the pool was also little girls. Little girls seems to present UTIs more frequently after the 30th day. So that proves that there's some UTIs associated with the procedure itself. Also, another part of the study includes the fact that physicians that perform the surgery seem to have a less incidence of infections and UTIs than rabbis. In fact, I think the number is 8 sick children in a pool of 24 when it's performed by physicians, and 42 children on a pool of 87 when it's performed by rabbi. So that's another factor to be conscious about when you are in an hospital and you have a choice of physicians versus a rabbi, unless obviously you're doing it for religious, cultural issues. The other factor to keep in mind is complications. Along with the bleeding, the infection that seems to be marginalized by the use of perioperative prophylactic antibiotics, there's also the complication of physical damage to the penis itself. But also, after the child starts healing, there's factors like dehiscence and meatal stenosis and skin bridges that can develop later on once the child starts growing. Those are very important factors that I kept in consideration. Again, not only as a parent, but also as somebody that is in charge of a child and is making a decision for somebody that cannot make it himself. With all of these kept in consideration, my assertion is that once you have knowledge of the facts, you can make a good informed decision, and you should make an informed decision because this is a very important decision that you're going to be making for your child. It is not something that should be taken lightly, but with the right information and the very copious amount of information out there, you'll be able to make the best decision for your family. Thank you for listening. Bye.